Good morning, dear Mentors. This is Dr. Gleser speaking, right from Germany. We had to travel for a family emergency. Never mind, you've got this presentation ready for you as your question answered. So I'm Heike Gleser, I'm the consultant in sexual reproductive health, and I'm usually the person who answers your GP queries if they're not, if they have some trouble about deciding if HRT would be suitable, or if there are any better alternatives maybe, or maybe you started HRT and there's some side effects or bleeding issues. So I'm usually the person they ask, and I give advice 5 days a week and usually within a day or two. And I'm more than happy to give advice. So these are a few questions you ask Felicity and Adrian during your training, and I hope I can answer them over the next 45 minutes or so. These are the questions. So how does HRT work? What are the benefits? Does it help against cirrhosis, heart disease and dementia? Any health risks, side effects, and what are the different types? And if I don't want to take HRT, what can I do? Is there anything else I can do for my menopause? Are there alternatives, and what you can do about vaginal dryness? And how do I find out about how to get HRT prescribed? So how does HRT work? So HRT is hormone replacement therapy, as you know. Menopausal symptoms are caused of lack of estrogen, and HRT is just replacing estrogen, what otherwise your ovaries would produce, and therefore they're extremely useful and extremely effective in helping with menopausal symptoms. There are estrogen receptors all over your body from head to toe, and that's why you can probably, we came across about 80 different menopause symptoms in affecting, which can be affected, and this could be just mild symptoms and just goes away if you're lucky. But quite a few women have, on average, got 8 symptoms, and they last a lot of, they can last a few years, starting in the early perimenopause into the postmenopause. And in the perimenopause, HRT balances out fluctuation of hormone levels as an add-on to the hormones our ovaries would produce naturally. And in the postmenopause, it replaces the estrogen as the ovaries stop producing estrogen, and your body is screaming out for estrogen. As I said, the strength of menopausal symptoms is quite variable. Could be just a mild cry and you're fine, just adjusting your lifestyle and it just goes away. But some people have very severe symptoms affecting the quality of life, their family life, their work life, their relationship, and therefore definitely should consider HRT. So just to see, where does estrogen work, because that makes sense then, isn't it? It affects your heart, so lack of estrogen can give you really bad palpitations, affect your liver, your bones. So lack of estrogen can lead to osteoporosis or prickly bone disease in your skin. We all know about the effect of skin, of aging on your skin and your hair. Of course, the brain, we heard about the brain fog affecting your breasts. One of the common side effects of estrogen is sore breasts. It works on your breasts, and of course, it's produced by ovaries, but also helps the ovaries. So what are the effects, benefits of taking HRT? So the main benefits are really that it helps for the menopause. So it's very efficient to help with the menopause symptoms, and if you're fit and well and suffer from moderate to severe menopause symptoms, the benefits of HRT usually outweighs the risk until the age of 60. Meaning, you could every few years you could try to reduce your estrogen, your HRT, or stop it and see if you have recurrence of the symptoms, because often we grow out of our symptoms. Not so much a lack of estrogen on your vulva vagina, but definitely on the hot flushes, night sweats. It's just a minority of women who continue suffering from them long term. Usually yearly review is recommended, and and we say, you know, so we say about the moderate or severe symptoms, but actually, if you enter the menopause under the age of 40, so it's called premature ovarian insufficiency, or under the age of 45, which is between 40 and 45, it's called early menopause. You should really be on HRT to protect your bones and protect your heart from the lack of estrogen, and that would be even if you have minimal symptoms. And you know, under the age of 51, because HRT is just really giving you back what you would normally have, so there are very few contraindications. The most important one probably a history of breast cancer. So what are the benefits of HRT? It's menopause symptom control, including, of course, on your emotional, mental health, vulvovaginal health, sexual health as well, protection of bone health, you know, from osteoporosis or brittle bone disease, and protection of cardiovascular health under the age of 60, prevention from heart attacks, angina, strokes, and many strokes. The main risks are actually quite small. So there is a risk of blood clot, but only if you prescribe tablets, and mainly in women who have additional risk factors, you know, like obesity or which is a BMI, body mass index of 30 or over. There's a small risk of breast cancer also, but getting it, but not the risk is increased of getting breast cancer, so being diagnosed with breast cancer but not dying of it, because it's usually, especially these days, very much changed from 30-40 years ago. It's diagnosed and then it's dealt with. A small risk of endometrial cancer, of womb cancer, and there are and you know, the best way to prevent this is actually the Mirena coil as part of HRT, which is very high but very localized progestogen levels, which is very good in preventing womb cancer, and the gynecology even uses that to treat very early womb cancer or pre-cancer in women who can't have a hysterectomy. There's a small risk of heart attacks and strokes over the age of 60. So that's what was said, you know, at the age of 60, or kind of 10 years after after your final period, there's a slight shift of the balance of risk and benefits. I'm just saying, you know, the understanding of breast cancer, because loads of women are quite concerned about breast cancer and the risk of HRT. But if you have a little look at this, you know, actually HRT is not a massive risk factor. Much bigger risk factor is if you're obese, if you're overweight, if you're a smoker, and if you drink alcohol. So I mean, all these things actually, obesity and alcohol also associated in increased risk of womb cancer. So, you know, lifestyle factors. Oh no, I don't want to take HRT because I'm concerned about breast cancer, or maybe, you know, some family members suffered from breast cancer. You would say, well, okay, but I also I'm quite overweight. I'm not as fit as I can do. So thank you. Okay, maybe I take this as an opportunity to change my lifestyle, and then that should really outweigh the additional risk of breast cancer when you're on HRT. Yeah, what I want to say as well, you know, so just to see, you know, the timeline. So the black is the estrogen produced by your own ovaries, and the red one is the HRT required to control symptoms. So often if you start HRT in the perimenopause, you just really give, you know, you supplement and stabilize the very fluctuant levels, and that's why, you know, when they take your menopause levels and the perimenopause, often they come back as normal, and it's really frustrating. So yes, but I'm sure it's the menopause or perimenopause, and I said no, yeah, but the levels came back. Yeah, it's really frustrating, but it's normal because it's still fluctuant. And so, you know, if you catch it one day, it might be normal. If you catch it another day, it might be not. But you know, the ovaries, if they produce less, you know, you probably have to increase your estradiol as part of your HRT, and that's kind of frustrating. As I said, you know, I get kind of cries of help by GPs or practice nurses saying, oh yeah, she's been on HRT, she's been stable for a year and now it's not working anymore. So I'm not surprised, because I expect this not to work anymore, because at the moment, at the beginning, you just supplement and stabilize the levels, and then afterwards you have to replace. So often you have to actually increase the estradiol as part of HRT. So fine-tuning is very, very common. Do not despair. Hot flushes and night sweats, often the symptoms work very, very quickly, but you know, things like working on your mental health, the emotional health, the as I say, the emotional regulation, you know, how you feel. If you feel quite wobbly, very moody, this might take a little while. Also, the effect of the estrogen on your vaginal symptoms, the dryness, the soreness, the itchiness, the urinary symptoms, the increased frequency, maybe a little bit more likely to wet yourself when you have a laugh or have a sneeze. This will take time. I would always say, if you have vaginal symptoms at the same time you start HRT, I would also ask your GP to give you vaginal estrogen. So you could start this at the same time, you know, HRT, systemic whole body HRT and local estrogen. And then maybe after 6 months, if you're stable on your HRT, you might kind of phase the local estrogen out. But, you know, just to give yourself a head start, because it can take a really long time to work at the level of your vulva and vagina. And about 10-15% of women who are on systemic HRT, like tablets and patches, actually also need local estrogen. And there's other things which I always ask your GPs, you know, if they're, you know, especially, you know, people, for example, women who've been absolutely fine, and then suddenly age 60 they've got menopausal symptoms. It does not make sense, and they've never been on HRT. It does not make sense. Why does she feel the lack of estrogen now? It's probably something else going on. That there's also so, you know, if you have if you have some doubt about the diagnosis, if you have very poor symptom control by HRT, or if suddenly, you know, while you're already stable in the postmenopause, why we really shouldn't have to increase your HRT suddenly, you've got increased symptoms, please think about anything else. You know, there's loads of other diseases which can have similar symptoms. And, you know, as we say, you can have fleas and lice. That doesn't mean that, you know, they might just make so perimenopause could make those symptoms worse, or those diseases worse, or these diseases could make the perimenopause worse. So, you know, there's thyroid problems and the fibromyalgia, long COVID, the whole arthritis group, multiple sclerosis or MS, anxiety, depression, insomnia, PMS. Loads of my PMS patients get referred in their early 40s. And mental health, other mental health issues like autistic spectrum disorder or attention deficit disorder. So, so I was asked about the type of HRT. So just to say, you know, so there are two in the perimenopause we give a sequential HRT. So that's the estrogen every day, and then progestogen for usually 2 weeks on, 2 weeks off. The problem is, you can see that, so almost, you know, giving, because we like, female brains like stability. And you know, it's really useful to have the same hormone level every day. So giving progestogen 2 weeks on, 2 weeks off can cause a bit of instability to prescribing it this way. So ideally, that's the joy of the hormone called the Mirena, because then you can actually give the very low estrogen every day, and then the progestogen, very low progestogen every day, and then the estrogen. So estrogen is the good stuff, which helps you with the symptoms. Progestogen is necessary to make estrogen safe, because otherwise If you just give estrogen in the lining of the womb, overgrowth and becomes precancerous or cancerous over years. So you can't do this. And that's where the Mirena goes. And because the progestogen is really important for safety, but often has very little benefits otherwise, and can actually lead to side effects like worsening of mood or anxiety or depression. So once you're in the postmenopause, you can have continuous HRT, so it's the estrogen again continuously, and then the progestogen also continuously. And just for comparison, it's not HRT but combined hormonal contraception, so the pill. So you give actually the combined pill for 3 weeks, and then you have a hormone-free interval. You can imagine as part of HRT that wouldn't be ideal, having a hormone-free interval. Because you don't produce your own hormones. So just a few types. So we already mentioned sequential compared to continuous HRT. So why don't we give continuous HRT in the perimenopause? Because your ovaries still produce some hormones, and that would kind of cause irregular bleeding. So it's mainly about the risk of bleeding, which then needs to be investigated in the hospital, so to avoid this. So there are combined products. So if you've got a room, you need progestogen. There's some women, even without a room, who need progestogen. For example, if you had your room removed for endometriosis, or maybe you still have, they did a subtotal hysterectomy and they left your neck of the room, and there's still a lining of the room inside. So if you have any doubts, speak to your GP about it. But usually, so women with a room, you've got combined patches or combined tablets, estradiol only. So if you had no room, or the way how to use estrogen, estradiol, as I said, you need progesterone as well, but you have those two separate products. So that could be patch, a gel, a spray, a tablet, or even implants. We've got about a handful of women with estrogen implants in NHS Tayside because nothing else worked, and they were just not absorbing at all the other products. As I said, if you've got a room, you definitely need progestogen as well. And I already said the Mirena or similar hormone coils. There are 2 others, different names, which are actually cheaper. It's an excellent choice because they permit even continuous HRT in the perimenopause, which is better for symptom control, excellent bleeding control. So that's sometimes the only way to avoid bleeding in women who have that as a side effect. And it also provides contraception. You can also have tablets as HRT and as progestogen, and or capsule, which can be used vaginally, but that would be unlicensed. We also have pessaries of vaginal gel, but that is unlicensed, and we usually don't prescribe this. So somebody asked about lack of estrogen. What does that do to your vulva, vagina? As already mentioned, can cause loads of the dryness, the soreness, the itchiness, the pain at sex, so all the water pipe, the bladder, the vagina, and the vulva, they're all very estrogen sensitive. So the lack of it then causes the water pipe. You feel kind of like an UTI, but you go back and you get antibiotics, but actually it doesn't help, or never UTI is found, but it feels like this, the urgency, the stinging, and everything. So this is something you usually don't cure out. It usually gets worse, so it's really worth treating early, because once it's established, it's harder to treat and often takes time to work. So vaginal estrogen is very safe, so there are very, very few absolute contraindications. So even women who are breast cancer survivors, they might, after trying the non-hormonal treatment, if it doesn't work, they might be eligible to have vaginal estrogen prescribed. So it's worth asking your GP, so your GP can ask the oncologist or involve me as well. So often of great benefit of urinary symptoms, might not all what you need. You might need pelvic floor exercises and things like that, but often it adds to this. And as I said, be patient and persevere, because it often takes 3 or 6 months to work. And yeah, and if you, what I want to say, and it's often, you know, you prescribe it long term because it doesn't really get better. And if you prescribe it with HRT, you could consider after 6 months to stop it. Maybe you don't need it. And I would say don't read the leaflet, because it's quite scary. You know, because they say, oh yeah, it causes blood clots and heart attacks and strokes. But actually, you know, as I said, it absorbs so little, so we regard it. I would have no doubt to prescribe this to somebody who's 95 or 100. I would not mind at all. And it's just a few other things you can do to help with your vulva. We absolutely love lube and moisturizers, which are great additional help. You know, we like Yes, and if you go to the Yes website, you can get some free samples. Vaginal estrogen can also be, vaginal trainers can be used to estrogenize. This is for women maybe who want to have penetrative sex, either with a male partner or maybe with a sex toy, and find it really quite uncomfortable. Maybe they hadn't had penetration for quite some time, so vaginal trainers can be really helpful, and that can be also prescribed by your GP. Not the nice ones though, not the silicone ones, who just have plastic ones called amiel. Really, really important is pelvic floor exercises, and I'll mention this later. Moisturizing, external massage and internal massage, and again, you know, having a little sex toy which can be absolutely be used externally with a vibration, can really help to increase the blood flow locally. So just a little reminder, you know, pelvic floor exercises that can definitely help, and they can also help. So they can help with the symptoms of prolapse. They can help with urinary symptoms. They also improve sexual awareness, function, pleasure, and yeah, so loads of benefits. Sometimes, of course, if you've got a bad prolapse, you know, that's not all you need. You might need a pessary, you might even need surgery. But it's definitely a very good thing to add on. What kind of vaginal estrogen is there? So you can have creams, and the nice thing about the cream, you can use a little bit outside around your clitoris or between your labia if that's particularly affected by the lack of estrogen, but usually it's used with an applicator internally. Then you've got vaginal little tablets again with a little plastic inserter. You can have a transparent ring, as you can see on the right here. So this is changed 3 monthly and inserted usually by yourself. There are also pessaries and gels. Pelvic floor exercise, again, you know, really, really useful, and the Squeezy app is £2.99, NHS supported and absolutely worth it. It's based on cognitive behavior therapy. There are so other things, you know, what can I do apart from HRT or maybe additional to HRT? As you can see, you know, in the menopause, you know, the lack of estrogen actually reduces our thermoneutral zone. So thermoneutral zone is the zone where we are not freezing and we are not too hot. And in the menopause, it's much reduced, and that's because of the lack of estrogen. And that's how it means when we get cold much quicker, and when we get a little bit warm, you get a hot flush, and your body thinks, you know, you're in a desert and you're dying of a heat stroke, so it makes you sweat very excessively, despite the fact that it's actually not very warm. But there are additional factors which can affect the thermoneutral zone, so if you avoid them, you know, that will help with your hot flushes as well, because, you know, if your thermoneutral zone is bigger, you know, meaning that you're not chilled and you don't get a hot flush or excessive sweating, you obviously have less symptoms. And things affecting this is, of course, smoking, alcohol, coffee, and hot spices, stress, depression, and also obesity. So if you work on those and avoid those, that would be really useful. Insomnia, it can definitely be a contributing factor to unresolved menopause symptoms on HRT. because you know, every healthcare professional will know how insomnia can give you fatigue, mood swings, anxiety, depression, brain fog, and headaches. So really have to you help with the, of course, HRT will help with the insomnia, but that's not all you need to do. So there are some tips for healthy sleep. So you know, it's called sleep hygiene. You know, avoid the heavy food, avoid something exciting on stress just before going to bed. You know, just have a bit of wind down time, and you know, having something really routine, and avoid you know, being on your phone to the last minute, really. Um, just a few things, you know, where I come from, Germany, you know, is absolutely common, so that would be normal. A bed on the right side, the setting would be, you know, you've got actually two duvets, so you can obviously have duvets with different thickness, or you know, you could also buy a duvet which is a dual, it's called a split duvet or partner duvet or dual temperature duvet. So these are ideas if you have a partner which might be male, which might be female, who is who has a very different temperature need than you. And additional cooling you can obviously have with mattress topper or cooling pillows and natural fibers and things like that. Again, about sleep.you, about sleeping, sleep.you, that is a free NHS supported app, and you can download it. That's the info there. You can download it. Again, it's based on cognitive behavior therapy and really useful. Definitely recommend it. Other things, you know, you can help. Cooler temperature, good ventilation, suitable clothing, and fans, cooling scarf, cooling spray, all kind of things. So these are all environmental changes and what, right? You know, remember there's occupational health policies and rights. So if you feel, you know, there's no way at work, you know, you can do this, you know, and you know, that force you to wear really hot, sticky clothes and, you know, plastic clothes and things. So we in the NHS Tayside, now we've got kind of more loose fitting natural fiber menopausal clothes, which are much more comfortable. So if you doubt, if you're fighting, if you're really struggling with menopausal symptoms at work, definitely look at your occupational health policy and speak to your line manager if there's something they can help you with. The lifestyle change is absolutely essential. It might be the only thing you need to do to help you with your menopausal symptoms, or it's like an absolute amazing adjunct, not just really to help you with you, to make you feel better, but also to reduce your HRT risk and also reduce just for your overall health. So the healthy diet, the limited alcohol and coffee intake, the good sleep and sleep hygiene, and reducing stress. You know, there's loads of things you can do. Amazing apps like Calm and Headspace, which are really useful. And so reducing stress with yoga, breathing, mindfulness, relaxation, regular exercise, and especially outdoors for the vitamin D. There are some herbal medicine. There's, you know, you can imagine you can't really make much money out of herbal medicine. So there's little evidence, but probably the best ones, which work pretty well, is St. John's wort, black cohosh, and sage. The problem with St. John's wort, it's a liver enzyme inducer, meaning it can interfere with HRT actually. So that can't really be taken with HRT. The phytoestrogens, these are the plant-produced estrogens, which are in linseed, which are in soya products. And of course, you know, there are some evidence that complementary medicine like hypnotherapy, acupuncture, homeopathy, aromatherapy, and acupuncture can help. Homeopathy, there is a clinic in Roxburgh House in Royal Victoria Hospital, which accepts referral of people who can't have HRT. So if you have an absolute contraindication to HRT, like breast cancer, your GP might be able to refer you there. Another approach to help with additional approach which to HRT or the only approach is cognitive behavior therapy. So there is a professor down in London who's called Myra Hunter, who has done amazing research, and it's now supported by the National Institute of Clinical Excellence Menopause Guideline. And they're actually knowing that, you know, face-to-face group sessions, reading, they're all very similar results. And there is, at the moment, there's no online program specific for this, but we are currently, there's currently in Scotland people developing this, and this might be available at some stage. But everything, you know, if you've been referred to a general CBT counselor, or you've got an online program like Beating the Blues, you know, this is kind of, the techniques are very similar, so that's definitely can help you to get to grips with the CBT techniques to help you with menopause symptoms. Well, that's a little leaflet, so it's from Women Health Concern. It's a leaflet about cognitive behavior therapy. And there are some books as well, and there was a really good book available by Dr. Cheryl Green, which is now out of stock, but she's done a really good talk, and I'll just put this on there. Yeah, talking about loop. Yeah, it's just a reminder that loop is really, really important, and it's a cheaper sex toy, and it's good for you, but also good for your partner if this is male or female. The main points really is about, you know, if under the age of 51, if they're even, there are very few absolute contraindications to HRT. It's first line due to its cardiovascular, so heart and blood vessel and bone protection effect. You should be ideally on HRT, especially if you're under 45. Just to avoid this, and even if you have minimal or no symptoms from the age of 51, there are very few absolute contraindications. HRT is the most effective treatment for menopausal symptoms. We usually say if you're just very mild menopausal symptoms now and then a hot flush, you're coping really well, probably shouldn't be on HRT. But if your symptoms are moderate or severe and affecting your quality of life, absolutely not. So non-hormonal no drug treatments, you know, the diet, lifestyle, and CBT, as I said, excellent to treat mild menopausal symptoms. Also, to it's as an addition to HRT, and to help with overall health. The non-hormonal treatment options, there are some available, which are mainly antidepressants, because, you know, when I was talking about the thermal neutral zone, so that's actually, you know, how we perceive heat, that's actually based in your brain. So actually antidepressants help with this. So they're not used for its work as antidepressants, but to help with stabilizing the hormones and increasing this thermal neutral zone. The other medication like gabapentin, which can be painkiller, but also an anti-epileptic. Oxybutynin is actually a tablet to help with nervous bladder, which can help hot flushes, and clonidine, which is against a high blood pressure. But it's not first line treatment unless HRT is contraindicated or not wanted, especially under the age of 45. I really do not think, you know, they should be prescribed. If somebody has typical menopausal symptoms, it should really be a try with HRT. And they unfortunately often lead to side effects. Of course, HRT can lead to side effects as well. So common is usually hormonal side effects, you know, kind of sore boobs and nausea and headaches, and sometimes can even provoke migraines. But then, you know, migraines can be also because of lack of estrogen or fluctuating estrogen levels. Bleeding can be a common side effect as well of HRT, but it is quite common to get side effects on those medications, and they can interact with other medicine, and of course they can also be given additional to HRT if that's necessary to control your symptoms. This is a picture of a funny magnet with a big cross around it. So it's not evidence-based, and really avoid those desperate measures, because it's a complete waste of your money. Of course, there is a massive placebo effect. So loads of people, I had people sitting in my clinic and saying they had a funny magnet in their knickers and it was working really, really well. So good for them, but just be aware that there's a massive placebo effect with things like that. And the main thing is, so if you have any doubt, so if you think, if you've been told you have a contraindication to HRT, shouldn't be an HRT, or that's as good as it gets, can't do anything, you can always ask your GP to. So if there's a contraindication, the GP can ask you, let's say, a breast specialist or liver specialist or cardiologist for more advice. But also ask us for more advice, because we find that the thinking has changed greatly, really. I mean, I've been a menopause specialist for 10 years, and it's much more liberally prescribed these days. With things which we regarded as absolute contraindication are now kind of more regarded as caution, where you think, okay, you have to keep an eye on her liver function or on her blood pressure, but we're quite happy to prescribe it. So don't take no for an answer. To ask your GP to contact your specialist and or us in the menopause, and because it's much easier to get an answer from me than getting a menopause appointment, because our waiting list at the moment is 10 months. So it will be very quick, and I usually answer within a day or two. But just a few resources and further learning. So that we do have a menopause symptom chart, and I'm going to send it with this PowerPoint presentation, so you can kind of use that to fill it out and show to your GP about, or just to get yourself kind of in your head, what kind of symptoms it is. And of course, there's loads of overlap with other medical conditions. The symptom has also good to monitor your the response to HRT, of course. So you fill it out before you start HRT, and then use it, and then do it again at 3 months later. These are our leaflets. So this is like the QR code, and they are very useful. We also have vulvar, vagina, and bladder problems in the menopause. Ask your GP about it, how to get it. It is, I don't have a QR code. I have to ask somebody to do that for me. Yeah, so these are really useful leaflets, loads of information we have written. Women's Health Concern is the patient branch of the British Menopause Society. Loads of lovely, really useful, regular, updated and evidence-based leaflets. I say evidence-based because there are quite a few self-made menopause experts who have very little or no training in the menopause. There are also some other experts who don't always follow the guideline of the British Menopause Society, which includes Dr. Lewis Newson, who has the balance up. So I would just take it a little bit with a pinch of salt and double checking with other resources, which are Women's Health Concern or British Menopause Society, when you're not so sure, when her advice contradicts what your GP says or what I say. So Women's Health Concern, I mentioned that already, so just highlight there's a big menopause wellness hub, which is really useful. Loads of information about how nutrition and how to help you with your emotional health and your weight and to exercise. Again, some more leaflets about weight gain, menopause, complementary alternatives. Another website I really like is Rock My Menopause. So this has been funded by a bunch of GPs with a special interest in menopause and actually women's health in general down in Yorkshire. And so they're called Primary Care Women's Health Forum. Now it was Society. It was Forum before, so definitely worth checking out. Daisy Network is mainly about for women and their family and partners. with premature ovarian insufficiency in early menopause or under the age of 40 or 45. And that's just like a hint for my favorite sex toy shop, because it's funded by one of the nurses, and there's loads of one nurse, and there's loads and loads of information around sexual health as well, which I like. And thank you very much for listening. I hope you found that useful. If there's any major queries or any questions, you could ask Adrienne and Felicity about this, and I'm sure they will feed it back to me. So thank you very much for joining the program, Become Menopause Mentors, for your interest in this amazing, really important topics, and take care.